It's time for another new Kansas City Spotlight. Here's your host, Lauren Scott.
At Sunrise Psychiatry, they want you to know that if you're dealing with depression or anxiety, you're not alone and they're here to help. I went to their office and met with Dr. Sunny Elliott to learn all about it. So we're here today to talk about TMS. Tell me about it a little bit.
Yes, so TMS stands for Transcranial Magnetic Stimulation. It's a non-invasive way to treat major depressive disorder and anxiety, and this is actually the chair that people sit in for the procedure.
Okay, so who is a good candidate for this procedure?
Yes, so we are right now, FDA is approved to treat major depressive disorder and anxiety. Some of those common symptoms can be lack of energy, low mood, irritability, persistent worry, panic symptoms. Most will respond to TMS. Those that are at this point ineligible are those that have a history of seizures, those that have a history of bipolar disorder, and those that may have specific implants like pacemakers or defibrillators.
So when should someone consider TMS as a viable option?
FDA approved for major depressive disorder and anxiety. The severity at which a person comes to get TMS is different. Most times insurance will dictate the severity that's required for them to cover it, but in my opinion that is not something that has to be considered when you're talking about clinical symptoms. So I believe anybody can respond to TMS even if the symptoms are mild, moderate, or severe. Again, most insurances will not take a look at it for coverage unless someone is moderately severe.
And why is this so rewarding for you?
Oh my goodness, that is a great question. So I've been a psychiatrist at this point, completed with my residency since 2010. So I've been in the mental health space for, including training, about 20 years. We only have so many tools in our toolbox in order to try to help people recover. This is another excellent tool that provides a lot of relief for patients.
Love that. Okay, so if people want to learn more and get in touch with you, how can they do that?
Great, so we encourage people to give us a call, to check out our website. We have people that are very eager to be able to discuss options in terms of TMS and eligibility in terms of TMS with them. So please feel free to give us a call at any time.
This Kansas City Spotlight has been paid for by Sunrise Psychiatry.